We're going to make a classic progress note for a prescribing clinician in an inpatient setting. From the patient's chart face, click on the button Progress Note Prescriber. This will be the first of 2 training videos. This training video is going to talk about a classic progress note. The second training video is a simplified version of this classic progress note using the simplified layout button. But for right now, we're going to look at the program as it's designed right out of the box. And up front with you, we have 2 tabs for progress notes. Progress Note Part 1, the page that you're seeing right here. You can talk about medical complexity, different symptoms that the patient might be having, medical issues specific to the patient, constitutional exam, musculoskeletal exam. You can detail other body systems. You can talk about behaviors, immunizations, past family social history review, etc. We'll go down this slide in just a minute. Just to take you over here to Progress Note Part 2. It looks identical to the last page of the initial assessment, except that you have information pushed out for you. The medical history is showing, the notes and risk factors are showing, and I'm going to tweak this right here. Looks like I had put down, I'm just going to erase this here and come back to Progress Note Part 1. Okay. It's nice to use this classic layout if your patient has both psychiatric and medical issues, and you want to be able to document those on this progress note. Let's come over here, and the first thing I want to show you is I'm going to come all the way down to the bottom here. This is a button that you might not use that often, but it's nice as a reference to look at if you need to before you start working in this note. So it's the PFSH, the Past Family Social History Review. Let's click on it and see what we've got here. We haven't started the interval history for today's note, so this is blank. But when you scroll down, instead of going back into the prior initial assessment, if you want to review the past psych history or the medical history, social or family history, you can pull it up from within inside this classic progress note. You can read anything you want here. You can even edit these fields if you want to. Okay. To get back out of this field, once you're done reviewing, just click this button. And the program is going to give you what's the word I'm looking for? Pat on the back for doing that review. It's going to say a review of this patient's personal, family, and social histories was performed today. Okay, so now that we've gotten that out of the way, we're going to start here at the top, and you can start with clinical status or complexity. You can click these buttons, but if you come into the Start Here area, the program will actually generate a sentence for you. I'm going to say that my patient is moderate complexity today. The patient has had just a slight response to treatment. When I click this button, it puts down a nice opening sentence. And I'm just going to close up this little gap here and move my cursor over. Okay. In terms of symptoms, if your patient denies symptoms, the patient denies having any anger today, the patient denies having feeling any grief, for example, you can go ahead and put that in. But let's say your patient continues to have psychotic features, for example. A patient doesn't deny psychosis. We're going to go into the psychosis C list. And I'm going to come down here and say psychosis continues. It's about the same as it was when I saw the patient yesterday or the day before. Symptoms that are described by others, maybe family or staff. The patient's affect, this patient continues to have inappropriate anger, and that's the same as it has been. Behavior is still somewhat bizarre, but that's getting better. And the patient clearly has a thought disorder. They're highly illogical, and that's about the same as it was as well. If the patient describes particular symptoms, maybe the patient's delusional, the patient says they feel jealous delusions, you can go ahead and put that in and say, but they're actually getting better. So we've generated quite a bit of information here very, very quickly. Let's go back. You can go into any of these denies buttons, or you can detail any of those symptoms under the C list. Moving forward, if you want to go in and talk about other body systems, we make it easy in the progress note, just like we do in the initial assessment, to say the constitutional system is normal. I'm just going to put a space here so you can see this a little bit more easily. We also make it easy to say the musculoskeletal system is normal. This is actually going to give you a little bit more coding credit for E&M coding. If you want to say all other body systems are normal, we've got a button for that here too as well. If you want to do a detailed review of systems, let's say the patient says, you come in today and the patient says, oh, they've got a problem with their ears. So let me see, I'm going to go down here to ears and I'm going to say there's an abnormality and the patient's describing ringing in their ears and it's in the left ear. And otherwise there's no other abnormalities reported by the patient today. You can move in here and look at any or all body systems that you want to, including a pain scale, which is really nice. Okay. You can enter test results. In the event that you didn't see the initial assessment training video, I'm going to run through this again. When you click the new button, it's going to put down the date these were performed. I'm going to say these tests were pulled yesterday. And if you want to document a test result in your note and have it push out to the log area where you can trend it over time and have the test result automatically push out into your discharge summary, you want to enter your test results in this area. Typically, I don't come in here and document unless I have an abnormal test result or I'm trending something like a drug level, lithium level, or what have you. So let's come in here and push in a couple really nicely. I'm going to click the new button. Whoops. Sorry, I already did that. We're going to come down here to chemistry. And let's say that you have a, let me see here, how about a blood alcohol level? And it came back at 0.6 to 0.9 for whatever reason. Say they're drinking in the bathroom or what have you. You've documented that. You can save that information. And it's going to show right here in your note. You can come down here and do some more. Maybe you want to get a Depakote level. And the patient's Depakote level today is 60. And we're going to save that. And it's going to come down here. And you can just work your way on down. We've got lots and lots of options in here. Let's do a TSH just for fun and say that it's pretty high here, 7. We're going to go ahead and put that in. Let's come down to hematology and say your patient also has a low platelet count. It's running at 120,000. You can always type in more details. Just want you to be aware of that. If there's something that you need to add with a test result, it will show in your notes. So I'm going to save this. And even though it's not showing here, when we go back into our note and I scroll down, you can see where the add more details is showing here. And it's putting a little like NA after that. We're just going to get rid of this right here. Okay. All right, let's come down here. You can talk about behaviors if you want to. Specific behaviors that a psychiatrist or a medical doctor might want to talk about is medication compliance. If this patient's irregular, if I was the doctor, I might want to document that. And I might want to also come down here and say that impulses are only partially controlled right now. Let's go back. We already talked, I'm going to skip immunizations. Past family social history we talked about. You can update drug reactions from right here. Sometimes your patient will say, yeah, on admission, yeah, I can't take sulfa drugs. And then you see them a week later and they say, hey, doctor, I forgot to tell you, I also can't take penicillin. So you can always update that from a progress note. Let's just come in here and click the active button, go down to the drop-down menu, select penicillin, and the reaction date. The patient said, well, I had this 2 years ago. So I just put in today's date and backdate it to 2014. You could also click unknown. What happened when this patient took penicillin? They had a skin reaction, urticaria, and wheals. And I'm going to save that. And now this has been added to your list of adverse drug reactions. That's going to show when you compile your note on the patient's chart face and also on the medication administration record for the nurse to be able to see. This information has been now updated. Side effects, if there are none, you can click this button right here. I'm going to come up in here just to give you a peek at this. There's lots of side effects that you can put in here. A lot of patients complain of a dry mouth, for example. So let's click that. Patient reports a dry mouth. You can say whether you think this is a probable, possible, or unlikely side effect from a medication you ordered. I'm going to go with probable side effect. And so it puts that nice sentence in. If the patient reports no other side effects or you don't observe any, you can click this button right here, no other side effects. And I'll read to you exactly what was just input into the program. No other side effects are reported or are in evidence. Okay, so we're in good shape. You can see the areas that we've worked in. We're getting red X's. Program's just helping us keep track of where we've worked. Psychotherapy. I'm going to bop in here really quickly. I know in the inpatient setting, a lot of psychotherapy isn't done by prescribers, but on the off chance that you do a little bit of supportive therapy, let's say you talk to the patient about their self-defeating behaviors and the patient and their sadness. If the patient talks to you about additional information, you can make a custom button that says the following pertinent information was shared today. And let's see here. And you could come in here and put patient discussed, for example, and type in whatever you need to. We're going to go forward into psychiatric or therapeutic interventions that were done today. You assess the type and severity of the problem. You help them to gain insight and understanding into their illness. You looked at patterns of behavior. You talked about the importance of medication instructions and compliance, and you talked about risk factor reduction. If you are a prescribing clinician, you will be obligated to put down how much time you spent in therapy with your patient on the therapy side only, not for the entire encounter. And please don't use these options up here at the top there for people who still haven't done their DSM-4 notes. We're going to come in here and put down that you spend about 16 to 37 minutes and move forward here. Okay, coming over here, we have access to rating scales if you want to use those. They're pretty self-explanatory. Mental status exam. It's identical to the mental status exam that we did on the initial assessment. I'm going to run through it quickly for anybody watching this training video that did not see our initial evaluation mental status exam training video. So I'm going to talk about appearance. This time we're going to make the patient depressed. The patient is glum, irritable, minimally communicative, and unhappy. Speech and language are normal. Mood is depressed, severe. Tears, body posture, psychomotor, ideas but no intention of suicide. You can see I'm running through these areas pretty quickly. Affect isn't normal. I'm going to go in here and say the patient's affect is blunted. The patient stares at the floor during the entire interview, for one example. You can talk about associations. You can come down here and talk about psychosis. If your patient does have psychotic features, you can come in here and list them. The patient's psychosis is present, their behavior is disorganized, they're having command hallucinations, they're paranoid, and there's also obviously a thought disorder, and we can go back. If your patient does not have any psychotic features today, you could come in here and click the button, not psychotic, and it would put in this nice paragraph here. Anytime you push a button and put in content into your program that's not correct or inappropriate, or you've changed your mind and you want to erase it, just simply highlight, right click and cut, or you can click delete on your keyboard. Either way, the program is very forgiving. You can go back. I could erase this whole mental status exam if I wanted to and say, oh my gosh, she's not depressed. She's really manic. What am I thinking? I could go back in here and redo the whole mental status exam based on her mania. All right, let's go back to progress note part 1. Working our way down, there's some basic physical status. Most of this you probably won't use in an inpatient setting, so I'm going to skip over this. Seclusions and restraints. This is typically something that the nurses document too. The same with fall assessment. You can push in vital signs if you want to. I actually have a little button here, a custom button that separates my mental status exam from my vital signs, since they share a field in this portion of the program. If vital signs had already been done today by another member of the team and documented on this patient, you'd be able to click this button, use previous vital signs, And it says vital signs have not been taken yet for this patient today, so we can't get away with that. So I'm just going to show you how to drop in vital signs. You can do supine, sitting upright, simple, simple. You can talk about the regularity of the pulse, and you're a physician if you'd like to. You can talk about respiratory rate, temperature. Anything that you document under the constitutional exam is going to push into the note, and it's also going to go into the log area. You can trend each of these individual parameters over time. So if you get a height, and I'm going to put down a weight here to let's just say the patient's 170 pounds. When you click in here, it's going to generate a BMI. This patient had an elevated fasting glucose today of 130, and their A1C is also running a little bit tad high, maybe at 5.8. And when I click done, this information pushes in here. And like I said, all of these parameters will show on your log area. Okay, let's go back to Progress Note Part 1. And working our way down, we do have a pain scale. I'm going to run you through this pretty quickly. This is nice for patients with either acute or chronic pain. Let's say you have a patient with low back pain. Patient currently has pain in their lower back. The severity of the pain, depending on what you pick here, it's going to put in a pain scale. I'm going to tease this out so you can see it. We're going to pick severe. The pain is of severe intensity and interferes with concentration and interferes with tasks except for basic self-care functions such as bathing and eating. Look, you get a pain scale right here with the cursor closer to unbearable than bearable, just to contrast what would happen if you had picked very mild. You get a pain scale over here with the cursor next to no pain. So pretty quick and easy to do. You can come down here and detail the pain if you want to. Pain interferes with their sleep and their appetite. There's other options you can pick. What's the timing of the pain? The patient says that it's chronic right now. You can talk about the quality of the pain. Patient says it's sharp, duration and frequency. It's continuous. It's relieved by. The patient says, well, I've tried, chiropractic treatment, and I've tried massage, and I've tried physical therapy, and nothing helps. I'm going to just type that in here. Nothing really helps. Okay, patient, is your pain controlled? Nope, it's not. On a scale of 1 to 10, with 10 being the worst pain, how would you describe the pain right now? And the patient says, I'd call it an 8. All right, let's come down here, and we did the pain. Coordination of care. This is a great button here that you can go into. If you're coordinating care with other members of the team, you can push that in here. Coping with stress. We're going to be coordinating that care with the treatment team and maybe with specific family members. We're going to be doing discharge family with the planning with the treatment team, and medication information is going to be shared with the patient and with the family. You guys get the idea. We can move right back out of here. The other field that I'd like to take you into, typically psychiatrists don't link to the treatment plan. This is a nursing or a therapy function. If there were issues identified in treatment plan, you would be able to update the patient's progress in terms of meeting their treatment plan goals within your progress note. But like I said, that's typically a nursing or more likely a therapist intervention. So we'll skip this area. But I do definitely want to show you course during treatment. I think you're really, really going to like this button. Let's come in here. It's a blank field. You're going to click on this button just to generate a little line here that puts down today's date. And you're going to put down 1 or 2 sentences that are relative to what's going on with your patient right now today, either the best of or the worst of. And the idea is this sentence or group of sentences will not go into this note, but they will push out into your discharge summary. So you're creating a clinician summary each day, bit by bit, by documenting in your progress note so that you don't have to do it on discharge day, which is really a great idea. So I'm going to put down here what's going on with my patient today. Okay, so you get the idea. You can put down here as much or as little as you want. Looks like I made a little spelling error here. SBO, let me just get in here and put in my little N for, here we go. This is what I was looking for, response. Okay, so now when I go back, that information will be captured. And if you do this, every time you do a progress note, you're going to be so happy in your discharge summary because it's going to push this information out. The discharge summary is also going to capture any test results if you put into the program. It's going to capture your diagnosis on discharge. It's going to capture your discharge ordered meds. Discharge summary is going to be a piece of cake to pull together, much less stressful than what you have to do if you're currently dictating or doing this on paper. We have a private note area. I don't think many clinicians use this, but I'm just going to show it to you. Anyway, you can put in a date here. Basically, if you want to put down something super private about the patient, you can document it here. Having an affair with a sister-in-law. Okay, probably I wouldn't even put this under this area. I probably would just keep it in my head. But the idea is that you want to put down something private for your eyes only. It's now stored under here. If you want to get rid of that later on in another note, you can just click in here and you can erase it. The issue that I have with this area is that for the most part, you're not supposed to be able to get this information because it's not part of the legal record, and you're supposed to have protected information if you're a therapist working with a patient, a psychiatrist, or what have you. But it says here, please note this information may be accessed via a legal subpoena. So I would keep that in mind before I put anything in writing down here. Some physicians like to use this area and therapists for that matter, for putting down things that assignments that they gave to the patient, or just conversational pieces about the patient that they want to use this to sort of tap their memory when they go forward. That's kind of a nice area to go into, and you can kind of make notes to yourself and erase them when you're done. Okay, we are going to go on to progress note part 2. We're going to skip entering medications and entering clinical orders and doing medication reconciliation. Those workflows will be covered under a separate training video. Under instructions, recommendations, and plans, we have custom buttons that have been made here. You would make your own custom buttons yourself by clicking on this button right here. If you'd like to have further information on how to make custom buttons, it's on our training website or on our video website at www.ICANotes.com. Go to the support tab, scroll down towards the bottom, and there's 2 videos specific to making custom buttons. You can expand this field to enter in your set of instructions, see more instructions. I like to work on the left side first, and I'm going to say, for example, today that I'm treating a patient in a psychiatric hospital setting, and I'm going to be doing crisis-focused therapy. I'm a psychiatrist or a prescriber, so I'm also doing psychopharm, and I want this patient to participate in all unit activities. You have perhaps talked to the patient about the risks and benefits of medication, and you've made a custom button for that, so we can pop that in as well. There's lots of other options that you could use in addition to that. We're going to come back out of this area. And once again, it's showing right here. You can always type in information too if you want to. As a prescriber, the program is capturing the fact that you did a psychotherapy note, so it's showing 16 to 37 minutes as the time interval that you spent during supportive therapy. But generally speaking, you don't have to put a start and stop time for a progress note for a prescribing clinician. This is a field that's set up for therapists. Your medical history is going to show in the pink field here, and it's showing in all of your progress notes. I have this turned off. I don't want this to display in my compiled note, but I can override this setting and say, yes, there's something going on under this medical history that I think is important to include in this compiled psychiatric note, and this information will then be included. I'm going to turn this off. My notes and risk factors are showing right here. We have a suicide and violence risk assessment. Once again, If you haven't seen our initial assessment training video, you can come in here and talk about the history of risk factors. And I'm going to say that this patient has a history of elopement. What are their current risk factors? This patient has a borderline personality. What protective factors are in place? Family support. Therefore, the risk of suicide is moderate and the risk of violence is low. Pretty straightforward here. Your diagnosis has come forward from the initial assessment, but you can tweak this from inside this note by clicking the Enter button to expand this field. I'm just going to bump this up a little bit so we can see it a little bit better. I have an ICD-10 shortlist that I built in Settings and Directories with my favorite diagnoses that I like to use, both including psychiatric, medical, and social. I can pull diagnoses from there. I can come over here to my ICD-10 list and filter back to to put in a diagnosis. Let's just do one here. I'm going to come down to behavioral health, and I'm going to come down here to an anxiety diagnosis. And I'm just going to pick something off here, agoraphobia with panic disorder, and it comes in. You have the ability to make any diagnosis a rule out, if you'd like to. By default, when you enter or update diagnosis, they show as active. But well, this guy's probably active, but let's say this diabetes is chronic. That would be a good example here. We can change that to chronic if you want to get rid of a diagnosis. Borderline personality, you've changed your mind, you can click the X here. You can also reorder these diagnoses in any note. So if I don't like the order that they're in, I can, make anxiety number 1, and would just click on the number 1 here, and so on and so forth. And I'm not going to do that right now, but you get the idea. I kind of like the order that these are in here. Actually, wait a minute, let's just do this a little bit different. I'm going to do 1 for diagnosis, 2 for borderline, and I'm going to do my behavioral health as 3. And I'm going to come down with my medical, make that a 4. Okay, so now when I click done, I've reordered these. Perfect. And I'm going to just this down a little bit, and we're ready to go ahead and compile this note, save it as a progress note. And you now we're taking a picture of this and saving it as a PDF. We now have a progress note for the inpatient setting specific to a prescribing clinician. Once again, if you need to make any changes to the substance that's written here, do not make a change on this page. Go back into the work area. The only thing that we allow you to change on this field is something like a formatting issue like this. I'm going to electronically sign this note. Now it's signed and locked. Just to repeat, if you want to change something in this note that is signed and locked, go back into the work area. Let's just do this here quick. I'm back here in progress note part 2, and I'm going to erase this has been assaultive just as a demonstration here. That's going to go away. I'm going to recompile this note. And when I do that, the program is going to update the signature line, and it says, hey, this note was modified since it was e-signed. You get a little red X here. Let's just see what this looks like at the bottom. You have a signature line here, but you no longer have an electronic signature. And also all that formatting change that you made so nice on the prior note has gone away. So I'm going to re-sign. You can see that this area has been updated. And relock this note. And now this top note is your current legal document. If you're wondering where the prior note went to, nothing in ICANotes goes away. It just gets out of your way. It's living right down here. You can even click on it and see it. You could print it out if you wanted to, but I'm just going to get back out of here. Okay. Let's go back to the chart face. Here's your progress note, the classic version, and we're all done.